I'm Megan McDonald-Paulson, Executive Director of Chicago Ideas. We are grateful that you have chosen to join us this afternoon. Originally, today's conversation was meant to explore how creative collaborations between leaders in Chicago's technology and healthcare communities have resulted in life-saving medical innovations during the COVID-19 crisis. But given the recent events here in Chicago and all around the country, now does not feel like the right time for that conversation. Chicago Ideas stands in solidarity with Chicago's Black community. In the events that have unfolded over these past few days, we have witnessed the pain caused by the senseless deaths of George Floyd, Ahmaud Arbery, Breonna Taylor, and innumerable other Black men and women over the years. In these protests, we recognize a community exhausted by a centuries-old system of decision-making that has institutionalized racism and that has structured violence and inequality in the heart of our country and in our city. In light of this, we believe that today's conversation should not avoid this harsh reality, but rather be the first small step in confronting this reality head on. One conversation will never be enough to encapsulate the full reality of what it means to live as a Black person in Chicago, something I will obviously never assume to understand. But as we come together across the city to dismantle these racist systems and to devise new ones founded in equity and justice, we must do so with clarity about the scope and reality of this problem. And the reality of the problem is clear. This pandemic has disproportionately impacted Black and brown communities all over Chicago. Black Illinoisans are dying of COVID-19 at a rate 2 times higher than white Illinoisans. That is not by happenstance or by accident. This is an illustration of the continuum of structural racial disparity at work. That is what today's conversation will be focused around. Before we get started, I would like to make a note that our guests are more than happy to take questions, which you could submit via Twitter using our hashtag Chicago Ideas, or by using the Ask a Question box below. Guiding our conversation today is Lolly Bowen, a highly respected journalist and the Media and Storytelling Program Officer at the Field Foundation of Illinois. Hi, Lolly, welcome, and thank you so much for being part of our conversation today.
Thank you for having me.
I will let you take it from here.
Thank you so much, Megan, for that very lovely introduction, an extremely thoughtful one. I'm so happy to be here with you today and to take part in this important conversation. Before we get started, however, I just want to take a moment and acknowledge the current uprising and all of the activists, the organizers, the clergy and residents, the elected officials who are demanding justice, equity, and better outcomes for Black residents in our city. These are people who have been compelled by the murder of George Floyd, Breonna Taylor, David McAtee, Laquan McDonald, and too many others who have been victims of police violence. I want to say we hear you, we see you, and we are responding. We understand that the COVID-19 pandemic has forced many to reckon with the rampant inequalities that have long plagued this city. And I just want to express my gratefulness to all who are working to repair this historic damage in their own ways. Today, we will hear from 4 different speakers who will speak about the COVID-19 pandemic, its impact, and the efforts to repair it. First, we'll start with 2, then we'll shift to the second 2. We'll bring all 4 back together so that they can answer your questions. I'll get started by introducing our first 2 guests. First is the president and co-founder of Agile MD, who serves as the executive medical director for rescue care at the University of Chicago. Please join me in welcoming Dr. Donna Edelson. Welcome, Donna.
Thanks. Thanks for the invitation to be here. I'm honored.
Also joining us for the first segment of this conversation is the Assistant Director of Advanced Practice Nursing at DePaul, She is also a family nurse practitioner for emergency services in underserved areas. Thank you for joining us, Roxanne Spurlark.
Thank you for having me.
Welcome. And Roxanne joins us today in her full PPE gear, demonstrating for us just how to get this work done and also protect herself. To start, I know that, Roxanne, I wanted to start with you. Can you talk a little bit about the impressive ways that DePaul College of Science and Health has responded to COVID? And can you kind of talk to us a little bit too about what you would say to other nurses?
As far as DePaul, one of the, there are a number of things that are going on to really stand at the forefront of supporting efforts to support those impacted by COVID. There's a number of things like putting together a task force that will support tracing and tracking of individuals who may have came in contact with persons that were positive. There are things in place to support those students that may have been impacted, or overall just the whole quarter of being stressed out, looking at revamping the way grades are put in. But I think the most impressive thing for me was the ability to pull together resources in a time where we did not have enough PPE to go around in the city. And DePaul School of Nursing pulled together the resources of the PPE that they had at the university and really donated those to places that really needed PPE. So when you think about what's really needed in a community to be able to support those individuals, that really takes the top notch for me, because if you feel like you're impacted where you cannot serve without a mask and you don't have masks available, that really, it creates an injury or an ability not to perform at the highest peak. So I think that would have to go as the top notch or the most impressive thing that was done. As far as a message to nurses, that can come from so many different angles, but we just think about the sense of nursing in itself comes from a space where it has its own ethics and its own morals and its own principles. We have a code that we follow. And in doing that, the first three provisions in that, you really focus on taking care of the patient. The second three, you focus on yourself. You focus on the fact that you need to take on care of yourself, but you also owe it to others, your peers. And the third piece comes in the light of you have a social responsibility to justice and well-being for all. It's not dictated in one area or the other. So with us being 2.4 million strong, I think that in this time, it's time for the nurse's voice to take a stand. This was already created to be the year of the nurse. And what better way to serve with 2.4 million strong?
Absolutely. Thank you for commenting too on the component of self-care. One thing that has emerged, I think, through this crisis is recognizing just how important nurses are on the front lines to taking care of people, and seeing the dedication and devotion of nurses that were going to work, whether they had access to the proper PPE. Some were using methods to recycle, and being very creative in how they protected themselves, just so that they could continue to serve. Dr. Donna, I'm going to move over to you. I know that the usage of Agile MD has seen a surge since COVID-19 pandemic. Can you talk to us a little bit about how Agile MD was used before COVID, how it's being used now, and similarly to Roxanne, tell us what you have been most impressed by.
Sure. So Agile MD is a clinical decision support engine that sits inside the electronic health records of hospitals, and it does two main things. One is it does clinical pathways that can be deployed very quickly inside the EHR, and then it also has a whole predictive analytics suite that then powers those pathways. And so prior to the COVID pandemic, we were using it primarily, I would say the hospitals that were primarily using the analytics component to figure out which patients were at highest risk of deterioration, and also the clinical pathways primarily, I would say, in lots of different settings, but in the ER, lots of different clinical areas. And it was getting plenty of use. But what we saw with the COVID pandemic is how fast it hit, how little we knew, and how quickly things were changing. And so even just on day when we're trying to figure out basic things like who's going to need to be tested, who can we test, what's the capacity, which way are we going to do it? All of those were changing so fast, and we couldn't keep up. The way that the hospitals in general, and that plays to how the university in particular, I think, handled it. I was so impressed. I've been at the University of Chicago for over 20 years. This is the proudest I've ever been to be affiliated with the University of Chicago. And we did a bunch of things really, really well. So I will say the command center was up and running fast, and coordinated communications, but also didn't use the pockets of excellence that we've always had. University of Chicago is renowned for its silos of excellence. We've got lots of them, really brilliant people doing some really cool things. But what we were able to do was actually grab it, use all of those resources, but funnel it up so that we were coordinated and consistent. And so things like, as new data was coming in, we were able to get it, and we were using the Agile MD tool to deploy these clinical pathways and to put them, instead of sending things out in PDFs and emails, we were drowning in emails. We couldn't keep up. One day we had the right PPE. The next day we needed to switch to a different mask because we had run out of this and people needed to go get fit testing. And now you could get tested. Oh no, now you couldn't. And now if you needed to have SIM, and we were drowning in emails, and these clinical pathways were changing. And first it was intubate everyone, then it was put people on high flow nasal cannula. Then it was constant, and it would have been impossible to keep up. And so what we did was they actually used the Agile MD tool as the source of truth to deploy these clinical pathways, so they were right at the hand. So if you were taking care of a patient and you needed to figure out whether you were going to test them, you opened it up right inside the EHR, and then you could order everything you needed right there at your fingertips. And so you always knew you were opening the most recent one, as opposed to filtering through your email, trying to figure out, is this the correct pathway? Or no, wait, that one was from yesterday. But there are 6,000 emails just from today from my command center. And so that it was the combination, I would say, of the organization and also this tool that could just be deployed fast to everybody was incredible.
Mm-hmm. So it sounds like it helped to make a delivery of medical care more efficient, so that you could kind of wade through all these changes that were happening at once. You could actually filter through these many messages and then chart a pathway forward in terms of treatment and care. I'm curious about because there were so many rapid changes to how we were dealing with COVID. I wonder if both of you could answer, what were the most challenging changes that you had to make as a result? I know what the challenges have been for us as civilians, but in your field, what were the most challenging changes that you saw that you had to make? Roxanne, do you want to answer first?
I can. I think for me, the most challenging, I am a person who is really engaged in human touch with my patients. And being behind PPE, that has been a big adjustment. I mean, when you think about people already have, or they come to an area with a sense of not trusting, if you can't see the person that's caring for you, that makes it another level that you have to work through. So adjusting to the PPE, wearing a mask for 14 hours a day, that has been difficult, along with the fact of having conversations where I've also checked myself and my own feelings, because if someone asks you if they're going to die and you really don't know, it's having that convincing spirit when you're uncertain, you're having uncertain times yourself. That was the biggest challenge in the beginning. So now it's more so getting people to understand the importance of the mask and the importance of the social distancing, even though weather is getting warm, and it has shifted, but it's still the same as, when people present with questions that you just don't have the answer for. That has been the biggest challenge.
I'll say that for me, a lot of it has been changing. Has been the paradigm shift around having to think about the provider needs in addition to the patient needs. We're never think about provider safety. We're always thinking about the patients first constantly. It's how we were trained as physicians. We go through this residency training where we learn not to sleep, not to eat, not to go to the bathroom, and to put patients first all the time. And one of the things that I did early on was worked closely with the American Heart Association, and I led the effort to write the guidelines for CPR, CPR in the COVID period. And we struggled a lot with this whole concept of not starting CPR immediately, where it's one of those things that's so time sensitive. And the idea that we've spent decades focusing on how to start CPR immediately. And now the idea that we would delay to put PPE on ourselves to protect ourselves first before we do something that's life-saving, it is so anathema to everything that we have spent our lives doing. And now it's true that outside of the hospital, people think like that all the time. And you know, if you're a lifeguard, you don't jump into the water to save somebody who's drowning. You have to be careful first. But in the hospital, and I'm sure also in battle zones too, right? But in the hospital, we don't work like that. It's always been safe for us for the most part. So the idea that we have to actually think about our own safety in the space where we work every day is difficult.
Yeah.
Yeah, and you're thinking about your own safety and also the safety of the patients, because if you're not safe, then they're not either. You're kind of both at risk in this circumstance. Roxanne, one of the things that you kind of alluded to in your comments was about the reopening and the weather and how that has relaxed many of us civilians and those of us who are in the public. I wonder, what advice do the both of you have as the city starts to reopen? What would you tell people to, remind them to stay vigilant, or what should they be looking for as the restrictions loosen? Do you want to start, Donna?
Sure. So a couple of things I would say. One, we don't really, there's so much we still don't know. And so I think we need to be honest about that and be looking at sources. Most of us don't have time, particularly people who aren't in healthcare, to be combing through the literature yourselves to stay up on top of it. And so we have to trust our experts. And that's particularly hard right now when we're in a society that's sort of anti-expert. We're hearing from the government this anti-expert, research approach. We have to trust our experts. If we can't, it's complete and total anarchy. And so the Illinois Department of Public Health has been great. The city of Chicago has been great. CDC, these guys are experts who are distilling the information for us. And so we have to be able to trust them and follow some of those guidelines, knowing that that the information they have may change. We don't know everything. We're so early in this pandemic. And the other thing I would say about the thing that's really important is that remember that when we're out there doing our work in social distancing and wearing masks, that isn't just for us. It's like vaccines. You're not wearing the mask to protect yourself. You're wearing the mask to protect other people when you're out there. For the same reason, when you're vaccinating your kids for measles and smallpox, you're actually not doing it for your own kids. You're doing it for the vulnerable and so that we can have safety across societies. There are people really who are at much higher risk. And so as a society, that's probably the thing that we need to focus the most on.
What about you, Roxanne? What would you suggest to the public as the city reopens and some of the restrictions loosen? How do you think people should conduct themselves?
I would have to echo Donna's sentiments. With it getting warm, we get to the point where we think all is well and we can go out into the world and be great again, right? But the reality is, like you said, we don't know. So my education every day and my advice to everyone every day, whether it's a 4-year-old or a 40-year-old or someone older, I say, wear your mask. That mask is to protect. Sometimes people don't understand until you explain the why. The why is you wear the mask to protect other people. as we speak to each other, you know, it's not intentional, but sometimes we have droplets that stretch out further than our mouths. And it's protecting that other person from that. Your own ownership comes into, or your own protection comes into the fact of you keep maintaining your distance from those who are not in your normal circle, like your household. And until we get to a point where that is everyday regimen, we're still going to have people that, you know, come about, and there's still going to be this linger of the virus. I think the biggest thing right now that I see every day, even today, we're seeing people that are coming in that are positive with no symptoms at all. So the only way that I can figure out that they're COVID positive is if something happens and it's an incidental find, meaning like maybe someone had a car accident and they're complaining of back pain, and then I do a X-ray, and then on the X-ray I'm seeing COVID lungs, so to speak. So they never knew, and it's not intentional that they're out like that. But until we treat everyone like we're trying to protect them and do the things to protect ourselves, such as the distancing, we're going to be in the same shape. So wear your mask, keep your social distancing.
Yeah, I hear both of you refer to the masks, and the masks are required in public. I wonder if you have any feedback about the alternatives to masks. For example, the shield. I see some people that are wearing the full face shields. Is that as effective? Is that as safe? And I'm also curious about what questions are you receiving from the public? What types of emails are you receiving? What are people curious about in this moment?
For me, Lolly, the mask, the shield in itself is only as protective as the frontwards going out, what's in front of you. So if you have someone that's standing over you, a conversation that I recently had with someone who was doing hair, if you're standing over a person and you have on the mask, what's to say that the droplets will not drop down onto that person? It's extra benefit to have the shield. You still need your mask. When we think about not touching our faces, if you're touching your face, you touch your eyes, there's a mode of transmission. I wear a face shield when I'm in the department. That's to protect anything that may come around. But I also wear my glasses when I'm in public, whether I'm reading or not. So it's having that extra layer. Most of our droplets come from our nose and our mouth. So if you have the shield on and you don't have the covering of the nose and the mouth, that may still leave you open depending on how you're interacting with someone.
What about you, Donna? What are your thoughts on it? And what kind of questions are you getting? What kind of emails are you getting, you know, both from the public and from your friends and family in this moment?
So I totally agree with Roxanne on the face shield. It's an addition, not instead of, and it's really only necessary. We think, and again, I will say we think because we don't know. It's if you're likely to be sprayed with something. So whereas the mask is to protect other people, the shield protects wet surfaces like your eyes, and probably also protects you from touching your face. So there's always the benefit in that. I'd say the question that I get most from friends and public in general is, when is this going to end? And I don't know. Yeah. You know, when are we going to go back to normal? I have no idea. I wish I knew the answer to that. I will say, just to bring it back to a little bit to this, to the timely topic at hand around racial disparities in healthcare, and particularly in COVID. One of the tools that has been particularly useful for us, and I think is because we know humans we're limited. We carry biases. Some of them we know, some of them are really obvious, and some of them are really, really not obvious. And so even those of us who think that we're not walking around with biases are, and we're doing things subtly. We don't even realize that we're doing them. And we see it when we review the data afterwards later in mass, that there are massive disparities. We've known this for a long time in healthcare. And so one of the things that I particularly love about analytics, I've spent the last decade of my life, as a data nerd, crunching numbers, trying to figure out how do we predict who's going to deteriorate. What I love about distilling it down to the ones and zeros is that it actually, it eliminates a lot of that human those human biases that we introduce to stuff. So, so having things that run on algorithms and also standardized pathways and order sets, they take out some of that bias. So the more you leave it up to people to just do whatever they want, the more avenue they have to put their biases in, whether they mean to or not. So something to think about as you're out there figuring out how you want your providers to act. And ideally, we'll call attention to it. It's incredible. What's happening right now is amazing and reminding us all how important this is and how painful everything that has been going on for centuries is. And also, it's not going to solve. We're still not going to clear away all those biases, and so we're going to need to be able to recognize, own that we're limited, and figure out ways to work around it that take into account that we can't see everything that we think we can.
I'm glad that you brought up the disparities, Donna. You know, institutions and medical institutions specifically have to work on how they administer care and how they receive patients if we're going to see a difference, particularly in minority communities and the Black community. But I'm wondering from the both of you, what do you suggest for residents who want to have agency, who want to advocate for themselves, and who are going into a system that is a medical system that is biased? How do you push back against that? Roxanne, I know that you work in underserved communities. What do you suggest to the attendees of this program who may have relatives that have to go to the hospital in this very crucial moment?
I would say that if you're in a situation where you're already under care, that you will definitely ask questions that promote more than one option, because sometimes in bias and in hurry, there's the thing of this is the only option you have. So advocate for yourself in having more than one option. Seek multiple modes of care, in self-care, in speaking with someone, having that family member or that person as a quote unquote mentor, so to speak. Have someone. If there's places where you can seek those type of opportunities. But like Donna was saying, there will intentionally or not, there will be those instances where things happen. And until we get to a place where those things are removed, when we're really looking at implementing equity, you know, there's going to be a difference. I even look at now with the way nurses or healthcare professionals, frontline workers, essential workers, whoever it may be dealing in COVID, those people are interacting at a level where they're going to have a mechanism of injury to their morals. And that turns up being a social determinant of health in itself. When there's a stress, we know that if you're stressed out, a couple of things are going to happen. You're going to end up with high blood pressure. You're going to end up with diabetes. These are cortisol things that happen because of stress, and then it leads you to somewhere else. So it's not just about understanding putting medication in your body. It's about getting down to the micro level of why. Why am I feeling this way? And sometimes it takes a team approach to get into that. So I would say, as an advice, make sure that your care is from a team standpoint. If you are not getting the resources that you need, reach out for help to community officials, even if it starts in your own community, or if it's a higher level with the city, reach out for help. Don't let your voice go unheard. Find your voice, speak up for yourself, and make it known. And I think that's all I have. It's not as easy as it sounds, I know.
Yeah.
And I would echo the don't go it alone, but which is particularly hard in COVID when we're not letting visitors come into the hospital and there are all these infections. In general, we're all at our most vulnerable when we're sick and scared and alone. And so even if it's over the phone, don't do it alone. Have support. And the other thing is, I think both the patients and providers need to give each other the benefit of the doubt, recognizing that providers they're trying to move fast, they're trying to do a bunch of things, and so they're stressed too, and that's actually when the biases tend to come out more. But recognize that people who go into healthcare generally, for the most part, are there because they want to help people. They're really not there to enforce biases and do damage to populations at large. And so to the extent that those things are coming up, they're probably unintentional. Give them the benefit of the doubt. That doesn't mean let them go. Don't, but assume that it's not coming from a bad place. Same from the providers to the patients. Assume that that's recognized, that when people are coming at you in an adversarial nature, sometimes they're coming from a place, they're scared and they're disempowered and they're looking for help and support. And so we all need to give each other the benefit of the doubt, but we need to communicate more. So whenever we're feeling that, and it is going to come, it's going to have to come for the patients, but but don't do it alone. Get some help and get some support.
Yeah, it's important that at all times we extend grace to each other. But in these stressful moments, particularly when people are ill and concerned that this illness is going to take them out, it could be very, very difficult. Thank you so much for what you have shared with us. We'll return to you to broaden the conversation a little later. I think we're going to switch gears for a moment. So again, thanks so much. We're going to bring two more guests on to talk to us about their reaction to COVID-19 in the community. So I want to bring in Betsy Ziegler and Holly Copeland. Let me introduce them. Betsy Ziegler, as the CEO of 1871, teamed up with MHub and Matter to mobilize the tech community around solutions to COVID-19 here in Chicago. Please welcome Betsy. Hi.
Hi, Lolly. Thanks for having me.
Oh, indeed. Also joining us with her is the Director of Public Affairs and Corporate Social Responsibility at Horizon Therapeutics, Holly Copeland. Thank you, Holly, for being here with us.
Thanks for having me.
So, I want to start with you, Holly. Can you talk to us a little bit about how Horizon stepped up to contribute to the COVID-19 relief efforts, and what was the motivation for doing so?
Sure. Thank you. Our founding CEO at Horizon, Tim Walbert, often repeats this mantra, right? Like we have our mission statement, our vision statement, these core principles, all very insightful and inspirational comments, but it all kind of boils down to his mantra, which is just do the right thing. And so for us, when this happened and it's the full extent of the impact started to reveal itself, there was no hesitation from our leadership team to figure out a way where we could be supportive. And so there was this immediate dialogue on what that could look like, whether it was supporting our employees. For example, we sent out a notification to anyone within the Horizon employee base that had a background in healthcare that wanted to take like a sabbatical to basically go volunteer on the front lines, that they would be able to do so, and that would be a paid opportunity for them, all the way to sharing numerous volunteering opportunities, matching employee donations, and then most significantly, stepping up with a pretty significant financial donation given the size of our company, which really focused on PPE production. So we initiated a partnership with the governor in Illinois, Governor Pritzker, and the Illinois Biotech Association to utilize some sourcing advantageous supply chain access that the iBio Institute had. And so that was one element. And then the other element was really thinking about how we could support the communities in which our employees and patients lived. And we ended up kind of narrowing our focus to community foundations, which are on the front lines in communities across the country, and really have that 10,000-foot view of where the existing service gaps might exist within a community. And we've been proud partners with them throughout the way, because they know which homeless shelters are in need of help, which domestic violence shelters, how are the food pantries doing, and they also have this direct line of communication with the public health department. So there's this very kind of comprehensive approach and how they're approaching the solutions that are needed. And so for us, it was lending support however we could, kind of leading from where we sit within the overall situation.
Yeah. Wow, that sounds like a really layered and textured approach, from allowing the employees the time to take off work and volunteer themselves, to all the way to giving donations to organizations that are on the ground. Betsy, if you could chime in here. I know 1871, in collaboration with MHub and Matter, also stepped up to contribute to the COVID-19 relief efforts. Can you talk about the work that your organization has done, and what was the motivation to get tech involved?
Yeah, sure. Again, pleasure to be here. I think first I'll say credit goes to Haven Allen, who's the CEO of MHub, for having sort of the initial idea to come together as a partnership. He called me, and before he got his first sentence out of his mouth, I said, yes, we're absolutely on board, as did Stephen Collins from Matter. And our three organizations, just for the audience's sort of sense of understanding, represent about half of all of the startups in Chicago. So we've got, between our current members and our alumni members, we've got about 1,600 startups out there doing good work, regardless of what problem they're solving. So we have this extraordinary convening power. So when we talked about, well, what is it that we can do with respect to COVID, we thought this was a unique opportunity to both aggregate existing and new technology and innovation, aggregate and convene experts in that space. And I'll just to give you a sense of, over the last 12 weeks, we've had over 300 technologists, entrepreneurs, innovators put their name in the hat saying, we're working on something that's important, that can have an impact right now on the crisis, or can help the city or the citizens of Chicago and the state of Illinois recover from the crisis. We've had hundreds of conversations. We've facilitated dozens of roundtables with healthcare professionals, with business leaders as they think about returning to the office. And I think most importantly, to tie it back to the earlier duo that you had a conversation with respect to PPE, in partnership with Northwestern and others, created thousands of face shields, new ventilators, new intubation boxes, UVC light enclosures, gajillion N95 masks, ambu bags, et cetera. Like, the list goes on and on and on about things that have come to the forefront, that I think we've been able to sort of, collect the resources and drive them in the right areas. And of the 300 or so companies, we've identified about 20, just over 20, that we think have a really opportunity for an outsized impact. And Dana is as one of them, with Agile MD. So it's great to, again, connect back to the earlier part of the conversation and share the stage with one of the innovators that's doing amazing work.
Yeah, because it's a medical tech, right?
Yeah.
And we need that as well. Thank you for that, Betsy, and for filling us in on just how the tech sector is responding to this. I think this crisis has just kind of forced so many of us out of our comfort zones. Holly, I wonder, how has the conversation in philanthropy changed and moved in response to COVID-19? I'm sure there was a way that you operated pre-COVID, but what is the conversation like now?
It's been an interesting change. Pre-COVID, there are these sort of loose networks within the philanthropic community where people come together and kind of share resources about not just nonprofits that are doing great work that you might want some of your peers to also lend support to, but also there was this kind of fixation on very specific areas of giving that are priority areas for your particular company or business, kind of laser focused. In our case, STEAM is one of our pillars of giving, right? Science, technology, engineering, the arts, and mathematics. And what I saw post-COVID was this real authentic desire from, regardless of what industry you existed within, there was no competition on who was going to come up with the best idea or have the best announcement or the best partnership. It was really this a coalition of everyone coming together and saying, okay, here's the universe of the folks that are on the ground on the front lines, who's going to support what, and how are we going to make sure that we're distributing resources in a way that makes sense strategically to make sure we're not missing any areas. And so that authentic approach to collaboration is something that I hope is going to stick around post-COVID moving forward, where we think about how we can really leverage all the resources that all these philanthropic entities, whether it's foundations or corporations or individuals, but how we can all kind of come together and bring our resources to bear in a way that makes sense for communities across the country.
Mhm. Yeah, so instead of the feather in the cap, it's really about deploying the resources to make sure that people are healed, because without our people, we are nothing, right?
That's
Yeah,
right,
Betsy,
exactly.
I want to pull you in too. So, as a CEO of a company, I'm curious about what challenges that you've faced and how you've had to adjust. You know, offices are closed down. Our beloved downtown has been empty for more than 8 weeks. How has this sort of impacted your role, and how have you been able to pivot and adjust?
Yeah, it's we could talk for a long time about that about that question. I think just to say at the top, I've kind of led from first principle. So principle number one, that my team stays safe and healthy, and then that the membership of 1871, for some of you that don't know, hundreds of people call that home, that they stay safe and healthy. And third, similar to what Holly was saying at the beginning of her remarks, that our mission stays constant, right? Our purpose, our reason for being, holds. How we deliver had to shift immediately, right? So like at noon on Friday, March 13th, I said, it's time to go home. And, everybody went home, and we had to immediately figure out, how do we deliver the experience of 1871 virtually for all of the different stakeholders? And that required, significant change done really fast without necessarily knowing what was going to happen, and trial and error, and experimentation, et cetera. So that was hard. I would say that because we're surrounded by entrepreneurs and surrounded by people who take risks all the time, if I had to choose anybody to go live through a crisis with, it's those kinds of people, right? It's the people that embrace really hard problems, that have a glass half full orientation to the world, are not afraid of constraint, right? So that actually helped fuel it. I would say, I think the hardest thing that we've gone through is probably what's happened over the last 10 days, and that certainly it's been happening for hundreds of years, as was mentioned at the beginning of the conversation. But how the impact on the Black founders in Chicago, the Black leaders of growth stage companies, the Black members of my team, the Black board members, the Black mentors, et cetera, that. What we've been going through over the last 10 days has been way harder than anything with respect to COVID, because it's at the base of our humanity, and how we're going to show up, and how we're going to make sure that we're doing the right things to support everyone, and sort of change direction on the paths that we've been on for lots of reasons that we can dig into, if that's helpful.
Yeah, Betsy, I'd love to hear a little bit more about how you plan on embracing change, and what the conversations have been like as a result of the uprising. And I don't know if it's impacting your conversations too, Holly. I know at the field we have a mission, and that mission is in part to serve Black communities. So we've had a lot of conversations around it. What about you?
Me, Betsy, or Holly?
Betsy.
Okay, all right. Yeah, so I've had many conversations with Black members of my team and Black founders. Certainly, I have it over time, but really intensely over the last 10 days or so. I've written a letter to our community very clearly stating that we believe that Black Lives Matter, and this is kind of where we can show up to help in the conversation. When you look at the way capital is distributed, which is what sort of one lens on this, let me just pause and say something else. The inequity and the systemic racism hits public health. Certainly, we've talked about that at the beginning. It impacts education. It impacts housing. It impacts certainly the criminal justice system, and it really impacts access to capital. And access to capital is where my organization shows up and tries to be helpful. When you have less than 1% of the capital going to Black female founders, that's a real problem, right? And so what we're doing is we're having some intentional conversations with only Black founders and Black leaders of growth stage companies, beginning early next week, to really dig into understanding the core context, right? Because I don't have the same shared experience. I obviously, both from my color of my skin, but also I'm not a founder. So when you put those things together, really dig deep into a set of conversations, and then we are co-developing and co-creating both near-term and long-term solutions. I don't know what those are going to look like yet. I've had a number of non-Black founders reach out to me with several ideas of things that we can do. All those seem like terrific ideas, but until I hear from the voices of the Black founders and the Black leaders to make sure we're solving the right problems that actually impact them the most, I'm not, I'm going to reserve decision-making on that other list that comes through. So I would say that we're at the beginning of the journey. And I look forward to continuing conversations on this, both publicly and inside my own organization.
Yeah, it sounds like it's a time for listening and a time for reflection and learning, in addition to having a action plan and charting out a new map. What about you, Holly? Can you speak a little bit on how just the inequities that have been revealed more broadly have impacted your conversation?
Absolutely. I was actually going to mention listening, or kind of lead with that, because it's we've within the company itself started to have a lot of conversations around what it means to be Black in America, and how our colleagues have in the words of Seb, like haven't bringing their full selves to work for fear of how their experience might be misinterpreted or not understood or not accepted in a workplace that's predominantly white. And so as teams, we've started having very open conversations where there's been a lot of listening and a lot of sharing and a lot of tears shed. Just yesterday, I was on one, and one of my colleagues shared a story about her son that, I think when that is a day-to-day experience for so many people, and it's sort of been a brutal reality that's been kind of behind the curtain for a lot of folks, because it's just not their experience. If you're an empathetic, caring person, when that curtain gets pulled back and you start seeing that pain, it's very powerful. And so I think what we're trying to do is first and foremost, listen, hear the voices, try to adjust the reality that exists within the workplace, right? So everyone feels truly that they can bring them full selves to work, and that that's supported in an authentic way. But then also thinking about how we show up externally, right? So who are we working with from a vendor supply chain perspective, right? Like, how are we taking the financial resources that we have as a company and leveraging them in ways that can have an effect on structural injustices from an economic perspective or from an access to opportunity perspective. So, evaluating that, and then also establishing a longer term commitment to how we show up in those communities. So I mentioned earlier in my comments that a lot of companies or foundations will have their priority areas of giving. And for us, there's always been this ribbon within our pillars that have focused on communities of color, women, marginalized communities. So every investment we're making is intended to be inclusive and bring folks in. And I think where we are today is we need to be more intentional about how we're focusing on those communities, and to show up in solidarity in a very public way on how this is also a priority area for us. And it goes beyond taking a pledge and words that might be used, but it needs to be followed with true action. So I know that's our intentionality, right? Is to recognize the intersectionality of all of these issues that affect race. From our case, in a public health perspective, housing, access to education, all of those things are intertwined. And so we want to be more holistic in how we're addressing our support, both internally and externally.
Thank you for that, Holly. Betsy, just to kind of shift back a little bit to COVID-19, just because that is the topic of today that we're focused on, but to then also kind of layer in some of the inequity. As the city reopens, and 1871 has been such a hub. It's a space that operates on people and on energy. But we know that there are pockets of the population, particularly Black and Latinos, who are more impacted, who are more vulnerable, who are less safe in those kinds of spaces. How do you replicate that energy and then keep this population, this very important and vulnerable population, safe through this?
Yeah, I think it's a great question, and I think I have sort of a two-part answer. Part one is we came to the realization or the conclusion maybe 18 months ago that in order to have the 1871 experience in sort of this education and support to build a business, which is extremely important because that's where like all the new job growth comes from, is from small businesses and new businesses. And so it's like never been more important time to have new business growth, right? Is not to assume that everybody has to come to 1871 to get that energy, to get that experience, to get those mentors, to get that education. And so we made a commitment again about 18 months ago to be connected to all 77 neighborhoods in Chicago by 2022. And we spent the last year working with leaders in 35 of the 77. Those 35 were the ones that had indicated more interest in being connected to tech, more interest in needing support for their residents that are, building businesses. And so we have, partnerships and programming and co-branding and a number of things that are going on in those neighborhoods directly, certainly pre-COVID. We're also building a fully on-demand digital curricular platform that will be delivered for free to, hopefully through partnerships like the Chicago Public Library, the Englewood Accelerator, et cetera, again, to arm people with the information that they need to build a business. During COVID, we've shifted a lot of our energies to helping small businesses digitize, and most of those small businesses are on the South and West Side. So how do we arm those leaders of those organizations, the restaurants, the hair salons, the landscaping services, the dry cleaners, et cetera, with tools to help them bring their businesses online, to give them a sense of being able to engage even when things were closed down. And the last thing I'll say is then what happens at 1871, where we have explicit programming for members of different affinity groups to help a peer-based cohorted effort that people can go through and get access. So, lots said there, Lolly, but I think the main insight is we're trying to be helpful at both the level of tech startup as well as small business, because those things don't have to be the same thing. And the combination of us going out and meeting people where they are versus expecting everybody to come to us, because I think kind of going to your point about safety and confidence and feeling like you fit, that takes time. And, for lots of reasons, people may choose never to do that, but that doesn't mean they should miss out on having the opportunity to actually build a really well-designed, well-supported business.
Yeah, wow. Holly, I have another question for you, but we are running out of time, and which is always what happens when you're having a great conversation, right? So I want to take a moment and just kind of bring Donna and Roxanne back in with us. And hopefully we'll have a little bit of time left to get to a question about if you're, I know Horizon has decided to invest in anti-racism work and invest in organizations that are working on the ground. And I wonder how you leverage that to influence other organizations to say, this is all hands on deck. This is not just for, a couple of groups, but so many have to be mixed in. So if you could think on that, maybe we'll get to that question. But I also want to ask this question that is coming from our attendees and from the audience for Roxanne and Donna. When it comes to COVID, should everyone be tested? And I wonder if you could talk about how doctors and nurses are dealing with the depression and grief that has come with this period of time. Can you start, Roxanne?
I can. I come from a personal space that, and it may not be the right place, Lolly, but it's what I feel. An actual test does not change the trajectory. It does not, it's the positive or the negative is not what heals you. That answer does not heal you. The practices are what keep you safe. And like I said earlier, if we assume that everyone has the opportunity to spread because only 50% of the population show up with actual symptoms, if we take it to that place, then we're all protected. some people just need to know because it makes them feel better to know, and that's okay. But I come from a place where the actual result does not change. I have seen people come in and they have all the symptoms and the test is negative. I have also seen people come in with no symptoms and the test is positive. So the best thing I would say is to protect yourself. Start with yourself and protect yourself.
I agree with Roxanne. Not sure there's any utility right now into testing absolutely everyone except as part of a study to understand how many people are asymptomatic. So if you're going into a community and doing a sample to figure out just how many of us are currently infected or have antibodies, that's the place for it. Otherwise, these tests they're still not great. Their false negative rate could be as high as a third. And so even if you think you might have it, a lot of times the test is most likely to be positive 3 or 4 days into you having symptoms. So you could still have it and be negative. And even if you tested everyone today, that doesn't mean that 5 days from now, unless you're going to test absolutely everybody every single day, then I guess that could be part of a strategy. But that seems really unrealistic. I can't see that happening. One point in time, random test everybody today. I don't see the utility in it. In terms of the emotional toll and how we as health providers are dealing with it, I think we're dealing with it the way we deal with all things emotional, which is not very well. We tend to be really much better and proactive about the physical health that we can touch, and we are really not great on psychological well-being. And I think we haven't even begun to see what the tolls of this is going to be on our psychological well-being, not just the health, the fear, the isolation, the financial that we've all been through. That is going to be the next peak, and it is going to be profound. And I think we're going to learn a lot of things about our healthcare system and how badly we've neglected that aspect of health.
Yeah, well, I think there's gonna a lot be revealed as the days go forward. It's sometimes one moment, one day at a time. Thank you so much, Donna. Thank you, Roxanne. Thank you, Holly. Thank you, Betsy, for joining us. I wish we could just continue this conversation, and maybe we can on Twitter or social media, but I know you all have important work to do, and I thank you for doing it to serve our city. And so with that, I thank the audience for tuning into us, and Megan, I will switch back to you.
So much for guiding this conversation. It was a wonderful conversation, and I wish we could have had it all day long. And also thank you for being such a wonderful friend to Chicago Ideas. Thank you also to Roxanne, Dana, Holly, and Betsy for giving your time to us to have this essential conversation this afternoon. I hope that you all stay safe and well. We encourage you to join us next week as we continue these vital conversations around our ongoing convening series, The Impact of COVID on Chicago's hardest hit industries and communities. On Wednesday, June 10th at 4 p.m., we will take a hard look at period poverty in Chicago in a conversation led by youth and activists made possible by Kotex and Walgreens. Then on Friday, June 12th at noon, in a conversation moderated by Dr. Helene Gale, President and CEO of the Chicago Community Trust, we will be bringing together Chicago's leading voices on social justice to identify what the priorities should be as we move forward from this watershed moment. Chicago Ideas is committed to continue to provide our community of curiosity meaningful and important conversations with the hope that it truly illuminates reality and inspires action. As always, be sure to subscribe to our newsletter for all the up-to-date information on our platform, or visit us at chicagoideas.com to learn more about what we do. Thank you, stay safe, and have a great evening.